Good evening. This is All India Radio and I am Lalema Aneja Dang, and with me is Prashant Kumar Sinha with the evening news. The headlines. Railways to run 2,600 more Shramik special trains over the next 10 days to ferry 36 lakh migrant workers back home. Domestic flights to resume from Monday, all flights coming from Delhi to operate from Terminal 3. Lockdown brings down coronavirus doubling rate from 3 days to over 13 days. Finance Minister Nirmala Sitharaman says Atmanirbhar Bharat Abhiyan seeks to create sustainable demand base by augmenting employment opportunities. Mauritius thanks India for sending medicines and a 14-member medical team to fight COVID-19. And NDRF deploys 10 additional teams in West Bengal in the wake of Cyclone Umpun. The railways have decided to operationalize 2,600 more Shramik special trains in the next 10 days across the country. This initiative is expected to benefit 36 lakh stranded passengers. Addressing media in a press briefing in New Delhi, Railway Board Chairman V.K. Yadav informed that over 45 lakh people have returned to their native places since the 1st of May through the Shramik special trains. Railways started running Shramik special trains to move migrant workers, pilgrims, tourists, students and other persons stranded at different places due to the lockdown.
यात्री ट्रेवल किए हैं, ये सूचीबद्ध तरीके से एक स्टेट से दूसरे स्टेट में गए हैं। राज्यों के अंदर भी हमने ट्रेनें चलाई और उसमें करीब 10 लाख यात्रियों ने और ट्रेवल किया। तो इस तरह से ये जो आंकड़ा हमारा है 35 लाख और 10 लाख करीब 45 लाख का आंकड़ा बनता है जो अभी तक ट्रेवल कर चुके हैं।
Shramik special trains are being run from point to point on the request of both the concerned state governments. The railways and state governments have appointed senior officials as nodal officers for coordination and smooth operation of these Shramik specials. Mr. Yadav also informed that the railways will further make arrangements of more of such trains as and when requests are received from the state and district authorities.
भारतीय रेल ने ये भी इंतजाम किया कि किसी भी स्टेशन से अगर जरूरत पड़ेगी तो हम वो ट्रेन चलाने का हमने इंतजाम किया और माननीय प्रधानमंत्री जी के निर्देश पे सारे जो जिला अधिकारी थे उनको इंस्ट्रक्शंस दिए गए कि जहां भी उनको जरूरत पड़ती है, जो भी रिक्वायरमेंट आती है, वो अगर वो रेलवे को बताएं तो रेलवे जहां भी हमारा रेलवे स्टेशन है वहां से ट्रेन चलाने के लिए तैयार है। तो एक तरह से एक राज्य सरकारों के साथ मिलके एक सहमति के साथ एक सिस्टम बनाया गया और इस सिस्टम के तहत श्रमिक स्पेशल ट्रेन चलाई गई।
Railways had run 2,600 Shramik special trains in the last 23 days and around 36 lakh stranded migrants have been transported till now to their home states. Apart from Shramik special trains, Railways Ministry has started 15 pairs of special trains from the 12th of this month and announced 200 train services to be started from the 1st of next month. Railways has transported more than 97 lakh tons of food grains between 1st April and 22nd May this year. Railways has ensured availability of essential commodities like food grains through its freight services during the nationwide lockdown due to COVID-19. Railway Board Chairman V.K. Yadav said more than 3,255 parcel trains have been run to transport essential items like medical supplies and equipments, food items, milk and dairy.
Domestic airline operations are set to resume from airports in a graded manner from the 25th of May. Speaking exclusively to AIR News, Chairman of Airport Authority of India, Mr. Arvind Singh, said that airports in the country are fully prepared for the flight operations starting from Monday. He informed that all arrangements have been made at airports to ensure contactless boarding and to prevent any chances of contagion. The chairman said commercial passenger flights at the Delhi airport will initially operate from Terminal 3.
We are fully prepared to take care of the passengers' concerns about disease, their apprehensions about the same. We will ensure that the travel will be done in a very safe and hygienic manner. At Delhi Airport, only Terminal T3 is being used. So it will be a very smooth and state-of-the-art facilities when the passengers will see at Delhi Airport, which will help them. And this will all be done in one Terminal T3.
The Home Ministry had on the 20th of this month amended the guidelines on lockdown measures to fight COVID-19 to facilitate domestic air travel. A report.
Delhi International Airport Limited today said that all flights will be operating from Terminal 3. Entry gates, self-check-in machines and check-in bays will be allocated to airlines to avoid overcrowding by air travelers at the airport. Passengers of Vistara and Indigo would enter the airport through gates 1 and 2 only. AirAsia and Air India passengers will use entry gates 3 and 4. SpiceJet and GoAir passengers will enter through gate number 5. From clean personal spaces, sanitized washrooms to UV technology-enabled disinfection machines, Delhi Airport is doing everything possible to keep passengers safe. All arrangements have been made to ensure that there is touchless boarding of passengers. Food, beverage and retail shops will be open to avoid overcrowding at one place. Flight services were cancelled from 25th of March due to the lockdown and are resuming after a gap of 2 months. Suparna Saikia, AIR News, Delhi.
Under the Vande Bharat mission, a flight is arriving at Bengaluru with 177 passengers stranded in Dubai. After its arrival at Bengaluru International Airport at 9:30 tonight, the passengers will undergo contactless procedure for immigration and baggage collection. The airport authorities have introduced contactless protocol at the airport. More on this from our correspondent.
Bengaluru International Airport has introduced innovative contactless procedure to minimize physical contact due to the pandemic. The Managing Director and CEO of Bengaluru Airport, Hari Marar, has said that all airport staff, including security personnel, wear protective gear. Across the terminal, bio-waste collection bins are placed so that passengers can dispose their used masks and other personal protective equipment. Frequent sanitization and disinfection of baggage and trolleys and fumigation of terminal is being done for safe travel. All touch points are sanitized regularly at a predetermined schedule. Touch-free hand sanitizers have been placed across the terminal for the safety of passengers. Sitting across terminal, including at food outlets, has been rearranged and marked in a manner that promotes maintaining a safe distance. Sudhindra, AIR News, Bengaluru.
Punjab Chief Minister Captain Amarinder Singh today announced 14 days compulsory home quarantine for anyone coming to the state by train, domestic flight or by bus. The Chief Minister said, although Punjab is posting the highest recovery rate of 90% in the country, he is not complacent. Addressing the people through a Facebook Live event titled #AskCaptain, he said rapid testing teams would check on the home quarantined persons, while those found symptomatic would have to undergo thorough testing in hospitals or isolation centres. He said that the state government would not rely on any certificates of testing from anywhere else. He cited Punjab's experience with those who came from Maharashtra and Rajasthan, as well as the most recent case of Dubai, from where Punjabis coming back had tested positive despite carrying medical certificates showing them to be negative. Government got into action to help stranded migrant workers as soon as COVID-19 hit India. Briefing media in New Delhi, the Home Ministry officials said that the centre released advisory on the 27th of March to check movement of migrant workers and to provide them with shelters, food packets, food grains and essential items. She said detailed advisories were sent to states and union territories to check possibilities of rumour mongering regarding shortage of food and essential commodities through publicity. She said special attention is to be paid to food, shelter and education and sanitation in the relief camps and food camps.
स्टेट्स और यूटीज को ये भी एडवाइस दी गई कि अगर कहीं अफवाहें फैल रही है तो उसको वो रोकें। कुछ अफवाहें मद्देनजर आई थी, जैसे कि खाने की कमी है या आवश्यक वस्तुओं की कमी है, और वो विशेष ध्यान दें कि जो हमारे रिलीफ शेल्टर्स है उसमें जितना भोजन की जरूरत हो वो उपलब्ध हो, सैनिटेशन वगैरह का वहां पे ध्यान रखा जाए।
The government has said that the decision of nationwide lockdown has helped contain the spread of COVID-19 in the country. In a press briefing by the Health Ministry, Dr. V.K. Paul, chairman of one of the empowered groups formed for handling COVID-related matters, said the doubling rate of COVID-19 cases was 3.4 days when the lockdown had started, and it is now at 13.3 days. He said the lockdown proved gainful in terms of preparedness. He said that 80% of the novel coronavirus cases are concentrated in primarily the 5 states of Maharashtra, Tamil Nadu, Gujarat, Delhi and Madhya Pradesh. Mr. Paul informed that COVID-19 specific health infrastructure was created, testing capacity increased, healthcare workers gained experience and confidence to fight with the virus due to the nationwide lockdown. Health Secretary Preeti Sudan today interacted with 11 municipal areas which have high caseload of COVID-19. These 11 municipal areas are from Maharashtra, Tamil Nadu, Gujarat, Delhi, Madhya Pradesh, West Bengal and Rajasthan. During the meeting, it was pointed out that the focus needs to be on prevention through active screening of high-risk and vulnerable population and groups. It was also pointed out that testing needs to be stepped up in some municipal areas to ensure early detection of cases, timely clinical management, and a reduction in the fatality rate. They also need to be mindful of ramping up the health infrastructure to ensure preparedness for the next 2 months, with special focus on isolation beds with oxygen, ventilators, and ICU beds. The measures taken and best practices followed by the municipal corporations for the management of COVID-19 cases were also discussed. The Health Ministry said a total of 51,783 people have been cured. In the last 24 hours, 3,250 patients were cured. The Ministry said the total recovery rate has reached to 41.39%. The total number of confirmed cases is now over 1,25,000.
Indian Council of Medical Research, ICMR, has said that consuming the anti-malarial drug hydroxychloroquine reduces the chances of getting infected with coronavirus. ICMR has issued a revised advisory on the use of hydroxychloroquine. The joint monitoring group, including experts from top research bodies and hospitals, reviewed the prophylactic use of hydroxychloroquine in the context of expanding it to healthcare and other frontline workers deployed in non-COVID and COVID areas, respectively. The National Task Force constituted by ICMR for COVID-19 also reviewed the use of hydroxychloroquine for prophylaxis of coronavirus infection for high-risk population based on the emerging evidence on its safety and efficacy.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Railways to run 2,600 more Shramik special trains over the next 10 days to ferry 36 lakh migrant workers back home. Domestic flights to resume from Monday. All flights from Delhi to operate from Terminal 3. Lockdown brings down coronavirus doubling rate from 3 days to over 13 days. Finance Minister Nirmala Sitharaman says Atmanirbhar Bharat Abhiyan seeks to create sustainable demand base by augmenting employment opportunities. Mauritius thanks India for sending medicines and 14-member medical team to fight COVID-19. And NDRF deploys 10 additional teams in West Bengal in the wake of Cyclone Umphan. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
The Atmanirbhar Bharat Abhiyan stimulus package of 20 lakh crore aims at providing the required relief to every sector under stress. Finance Minister Nirmala Sitharaman, while interacting with BJP spokesperson Nalin Kohli on social media platform, informed that government has instructed all public sector banks to start disbursal of collateral-free loans through the automatic route. She said the series of announcements under the scheme also aim at creating a strong foundation for a hassle-free economic operation throughout the country. Finance Minister said long pending issues of sectoral reforms have also been addressed. Responding to a query regarding the fiscal outlay under the Atmanirbhar Bharat Abhiyan, Ms. Sitharaman said the economic stimulus is not only restricted to handing out immediate cash to people, but is also aimed at creating a sustainable demand base by augmenting employment opportunities. Finance Minister said that Reserve Bank of India has also taken timely decisions to extend relief on market borrowing and moratoriums on loans. She said these decisions will ensure affordable liquidity in the market. Finance Ministry has denied media reports claiming that the central government is considering a calamity cess on GST to tide over the economic crisis in the wake of COVID-19 pandemic. Sources in the Finance Ministry said that in the present economic scenario in COVID-19 pandemic, any purported proposal of introducing a calamity cess would be nothing less than an adversity itself. The source said any such measure will further dampen the consumer sentiments and could weaken market strength, especially when the government is endeavouring its best to boost consumption. The ministry said none of the countries, developed or developing, have increased taxes to counter economic impact of COVID-19.
Tamil Nadu Chief Minister Idapadi Palaniswamy has said there is no community transmission of COVID-19 so far in the state. Talking to reporters in Salem today, he said the disease spread has been reported more in dense pockets. He said sharp focus is being given in such areas to accelerate the disease preventive measures. Answering a query, he said he is in favor of bringing back people stranded in other states and abroad after the situation stabilizes in the state. Meanwhile, in Tamil Nadu, the COVID-19 tally has surged past the 15,500 mark, with 759 people turning positive today. 5 patients died of the disease today, taking the toll to 103 in the state so far. More from our correspondent.
The slew of measures to ease the lockdown restrictions by the union government, especially in rural areas, have begun paying rich dividends. The wheels of rural industries have started rolling in full steam, as seen in the deeply rural Dharmapuri district in Tamil Nadu. In the arid region, brick kilns and certain small-scale textile units dot the landscape, besides the vast rain-fed agricultural lands. A brick kiln owner at the Manjahalli village in the district, Mr. Shanmugam, has said the recent economic package announced as part of the Atmanirbhar Bharat initiative to the micro, small and medium industry is set to add steam to the kilns industry. He said as they were deprived of business for about 2 months, investment is very much required to revive them, and the economic package would come to their aid. With inputs from Dharmapuri Tandapani, Jai Singh, AR News, Chennai.
The Telangana state government has announced schedules for examinations which were postponed due to nationwide lockdown. Examinations will be held for the 10th standard from 8th of June. The government has also released the schedule for common entrance tests for admission into various graduation courses of higher education, including engineering, veterinary and medicine. They will be held from the 1st of July to the 16th of July in line with UGC guidelines. A report from our correspondent.
Telangana state has begun implementing several relaxations for business and other sectors during the lockdown 4.0, which will continue till the end of this month. Though the educational institutions are yet to get permission for reopening, the government is going ahead with conducting exams for students at various levels. The board exams will be held for 10th standard students from 8th of next month, with the State High Court giving its nod. State Education Minister Sabita Indra Reddy today announced the schedule for conducting common entrance tests for admission into various courses at graduation level. They will be held from 1st to 16th July in line with the UGC guidelines. However, the educational institutions have not yet given permission for reopening, and most of the institutions are holding online classes for their students. Lakshmi, AR News, Hyderabad.
Kerala continues to report surge in COVID-19 cases, with 62 more positive cases being confirmed today. A report.
The state reported the biggest spike in COVID-19 cases in a single day today, with 62 new cases, out of which 49 people are returnees from abroad and other states. The total active cases in Kerala rose to 277. 550 people had recovered from the disease so far. Chief Minister Pinarayi Vijayan said that there is no community spread in the state till now. He said that there exists no fear in the return of Keralites from outside the state, as the state is prepared to deal with the situation, and the government also trusts that the returnees will adhere to the norms to avoid contact spreading of the pandemic. Chief Minister clarified this during his appearance on Twitter Town Hall today, through which he interacted with Keralites across the globe. Meanwhile, under the Vande Bharat mission, 5 flights are carrying expatriates from Gulf region to Kerala today. Flight from Muscat to Kochi and Dubai to Thiruvananthapuram arrived a short while ago. 3 more flights from Abu Dhabi to Kannur, Dubai to Kozhikode and Muscat to Thiruvananthapuram is scheduled to arrive soon. Mayush Shah for AR News from Thiruvananthapuram.
Sikkim's first COVID-19 case was reported today. At a press conference in Gangtok this evening, Director General cum Secretary of State Health Department, Dr. Pempati Bhutia, informed that the person diagnosed with infection is a South Sikkim-based 25-year-old returnee from Delhi. The person reached Sikkim on the 19th of May on a bus from the national capital. Here's a report.
Director General cum Secretary of Health Dr. Pempati Bhutia informed that the infected person was initially quarantined at a facility in Ravangla, South Sikkim. The result of the sample from North Bengal Medical College was received today afternoon. Dr. Bhutia provided more details.
We have got just one case of COVID positive in SNM hospital in Sikkim, and we had done the RT-PCR test yesterday. It was positive. This guy is a 25 years old boy and he is very stable right now. He doesn't have any symptoms right now.
The person is asymptomatic as of now and will be kept in the isolation center at New STNM Hospital Sochigang near Gangtok. All persons who came in contact with the infected, including doctors and nurses, will be quarantined and tested further. With Saikat Sarkar, Parijat Sharma from Gangtok for AIR.
In the Union Territory of Jammu and Kashmir, people in Kashmir continue to stay indoors and avoided holding any religious congregation connected with Shab-e-Qadr and Jumatul Wida due to the coronavirus pandemic. People are strictly adhering to social distancing norms and other government guidelines issued from time to time in an effort to prevent the spread of virus. Our Srinagar correspondent has the details.
Due to COVID-19 situation, there were no congregational prayers held in Srinagar on the occasion of Jamatul Wida, which is the last Friday of the holy month of Ramadan. People continue to stay indoors as was advised to them by the religious clerics as well as government authorities in an effort to prevent the spread of coronavirus pandemic. The masjids and shrines including Dargah Hazratbal and Jamia Masjid in old city areas of Srinagar city remained locked for the devotees as a precautionary measure in the wake of coronavirus pandemic. However, amid the lockdown, authorities eased restrictions in certain areas where markets opened and people were seen buying the essentials ahead of Eid ul-Fitr. This is Sunil Kohl for AIR News from Srinagar.
In view of the alarming rise of COVID-19 cases in Maharashtra, making it the worst affected state in the country, the state is receiving aid and support from various corners comprising of common citizens, corporates and even celebrities. Maharashtra Chief Minister Mr. Uddhav Thackeray has received an overwhelming response from the people of the state to render their services to combat the novel coronavirus outbreak. As many as 21,752 people of the state agreed to render their services to the state in various capacities to the CM's call to join the force of COVID Yodhas in the state. A report.
In another support to the government in fighting the pandemic, engineering firm Tata Projects said it is augmenting hospital infrastructure with 2,304 beds at multiple locations across India to treat COVID-19 patients. Tata Projects is also turning a large section of Mumbai-based KEM Hospital's orthopedic center into a 115-bed isolation center, besides setting up a 72-bed isolation facility in HBT Trauma Center at Jogeshwari in suburban Mumbai. The company is assisting with project management for a 300-bed isolation facility at Seven Hills Hospitals in Marol, Mumbai. The company is also providing various expensive medical equipments, including ventilators, pulse oximeters, etc. Besides, Bollywood actor Sonu Sood received praises from Maharashtra Minister Jayant Patil for arranging buses for migrant workers desirous of returning to their homes. Devapriya Bhattacharjee, AIR News, Mumbai.
Minority Affairs Minister Mr. Mukhtar Abbas Naqvi has said that Hunar Haat will restart from September this year with the theme of local to global and comparatively larger participation of artisans. He said it will be organized after a gap of about 5 months. Due to the coronavirus pandemic and lockdown, the event is not being organized now. The minister said that social distancing, hygiene, sanitization and use of masks will be ensured at the Hunar Haat. There will be a special Jaan Bhi Jahan Bhi pavilion to create health awareness amongst the people with the theme of Say No to Panic, Yes to Precautions.
Arunachal Pradesh government is in the process of reviving the tourism industry in the state, which is one of the most affected sectors due to the COVID-19 pandemic lockdown. Sadhana Deori, state's tourism secretary, said that the department is working on a package which is aimed at providing relief to the affected entrepreneurs associated with this sector like hoteliers, homestays, etc. She said that fine-tuning of the same is under process. Team of researchers at the Centre for Nano and Soft Matter Sciences, CENS Bangalore, have developed a mask that helps to create enough space in front of the mouth while speaking. The technology has been transferred to a Bangalore-based company for mass production.
In an effort to guard against fake news being circulated on various platforms, we bring you our segment on fact-checking and myth-busters. A video of an overcrowded train is circulating on social media with a message wrongly claiming it as a Shramik special train carrying migrants from Mumbai to West Bengal. The Press Information Bureau fact-check Twitter handle tweeted saying that it is an old video of an overcrowded train in Bangladesh from the year 2018. Hariram Bansal, a farmer from Chhatarpur district of Madhya Pradesh, has received benefits under the PM Kisan scheme. He thanked the government for the initiative, saying it provided relief during the lockdown.
मैं ग्राम कदारी का रहने वाला हूँ। मेरा नाम हरिराम बंसल है। जो पैसे सरकार द्वारा आए हुए हैं 2000 रुपए पहली किस्त मिल चुकी है और दूसरी भी आ चुकी है। इसी प्रकार से सरकार हमको सहायता देती जाए। धन्यवाद।
In Nepal, 36 more persons tested positive, taking the total number to 584. According to the Ministry of Health and Population, 36 persons, including 27 people from Banke district alone, were diagnosed with COVID-19 this afternoon. Earlier in the morning, 32 persons tested positive. There are now 511 persons infected with coronavirus in Nepal, while 70 people have been cured and discharged from hospitals. Prime Minister Narendra Modi today spoke to President of Sri Lanka, Gotabaya Rajapaksa. In a tweet, Prime Minister Modi said Sri Lanka is fighting COVID-19 effectively under the leadership of Mr. Rajapaksa, and India will continue to support its close maritime neighbour in dealing with the pandemic and its economic impact. They also discussed the possibilities of promoting investments and value addition in Sri Lanka by the Indian private sector.
Prime Minister Narendra Modi also had a telephonic conversation with his Mauritian counterpart Pravind Jugnauth today. He congratulated Mr. Jugnauth for successfully controlling COVID-19 in Mauritius. In a tweet, Prime Minister Modi said the people of India and Mauritius share warm and special ties based on a shared culture and values. He said Indians will stand by their Mauritian brothers and sisters during this difficult time. Mr. Jugnauth conveyed his condolences for the losses caused in India by Cyclone Omphan. He thanked Mr. Modi for sending INS Kesari to Mauritius as part of Operation Sagar with a consignment of medicines and a 14-member medical team to help the Mauritian health authorities fight the COVID-19 pandemic.
In our series Experts Speak on All India Radio, we bring you views of leading medical experts on COVID-19. President, Public Health Foundation of India, Dr. K. Srinath Reddy has said it will take some time to develop a vaccine against the COVID-19 infection.
WHO का कहना है कि कम से कम 18 महीने लगेंगे एक अच्छा वैक्सीन सारी दुनिया के लिए उपलब्ध हो, क्योंकि एक तो वैक्सीन के ट्रायल्स में कई सारे स्टेजेस हैं और दूसरा मास प्रोडक्शन। ये देखिए, ऐसा वैक्सीन नहीं है कि कुछ ही देशों के लिए, कुछ ही लोगों के लिए है, सारा दुनिया मांगेगा इस वैक्सीन को। भारी मात्रा में वैक्सीन को उत्पन्न करने में काफी टाइम लगेगा।
Noted actor Salman Khan has appealed to the people not to believe or spread rumors during the COVID-19 pandemic. He said that the government is taking steps for the benefit of all and appealed to the people to follow all government guidelines and directions.
ये जो गवर्नमेंट है ये आपके लिए और हमारे लिए, हम सबके लिए बोल रही है, तो इसको सीरियसली लो, वाएं मत फैलाओ। सबको ऐसा लगता है कि ये हमारे साथ नहीं होगा, ये कोरोना वायरस किसी को भी हो सकता है, बस में, ट्रेन में, मार्केट में, हर जगह।
The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Listeners can ask questions to the experts on toll-free telephone number 1-800-115-767. This can be heard tonight on the FM Gold channel and additional frequencies from 9:25 p.m. onwards. 10 additional National Disaster Response Force NDRF teams from other locations have been deployed for rescue operations in West Bengal. Teams are likely to reach Kolkata by late night today. The West Bengal government had earlier requested NDRF for deployment of additional teams. Presently, 26 NDRF teams are deployed in cyclone-affected areas of West Bengal.
There will be a heat wave in New Delhi tomorrow. The national capital will witness minimum temperature of 26 degrees Celsius and maximum of 45 degrees Celsius. In Gilgit, the temperature will hover between 17 and 33 degrees Celsius. It will face a generally cloudy sky. In Muzaffarabad, there will be mainly clear sky, becoming partly cloudy towards evening or night. Now, before we end the bulletin, here are the headlines once again. Railways to run 2,600 more Shramik special trains over the next 10 days to ferry 36 lakh migrant workers back home. Domestic flights to resume from Monday. All flights from Delhi to operate from Terminal 3. Lockdown brings down coronavirus doubling rate from 3 days to over 13 days. Finance Minister Nirmala Sitharaman says Atmanirbhar Bharat Abhiyan seeks to create sustainable demand base by augmenting employment opportunities. Mauritius thanks India for sending medicines and a 14-member medical team to fight COVID-19. And NDRF deploys 10 additional teams in West Bengal in the wake of Cyclone Umpun. And with that, we end the evening news.